We're hearing from healthcare professionals on the front lines of the coronavirus pandemic about the shortage on supplies, particularly when it comes to masks. There's just not enough to go around.
Yeah. But some folks right here in our area are working overtime to make sure safety is a priority to keep our healthcare workers healthy. And that includes Peggy Baldridge, who joins us now by phone. Peggy, you're actually making masks. You say your daughter is a nurse, but tell us how this idea all came about.
She texted me one day from work and asked me, she sent me a link to see if I would be able to make some of the masks. So there's a hospital, a Deaconess Hospital in, I think, Evansville, Indiana, that made masks for all their employees, and volunteers are the ones that made them. And so they put a link out how to make the mask, and there's a video and a pattern. And so I looked at that and said, sure, that would be easy. And so she bought some fabric and the elastic and dropped it off. And I have made, I made 21 yesterday. So she needs 30 for her department.
Wow, that's incredible. Tell us, how long does it take for you just to make one of these masks?
Maybe 15 minutes, 20 minutes, because you have to cut it out. Sewing it doesn't take as long, but you have to cut it out. So I usually I got 21 masks out of 2 yards of fabric. So I cut them all out, and then I sewed them all together.
Wow. Peggy, what have you seen in terms of why that need is so great?
The N95 masks that they're using for the coronavirus are only available if you have a patient that's been diagnosed with the coronavirus. So they are left, nurses and other healthcare workers are left to wear just regular masks, which aren't as effective. So my daughter's plan was to wear a regular mask plus this mask that I've made over top of that, just for added protection since they can't access the N95 mask.
Did it surprise you to hear firsthand from your daughter that there just weren't enough masks? I mean, someone on the front lines of all of this.
It really did. Like, I thought they had them, but maybe they were just on short supply, but they don't have them at all. They're behind lock and key unless they actually have a patient that's been diagnosed, but you may have one that has it and you don't know that yet.
I imagine not just any mask will do. Are there specifics or regulations you're following for the ones you're making?
It has to be 100% cotton fabric, and the elastic is 1/8 of an inch, which we couldn't find, so we had to buy 1/4 of an inch and cut it in half. But you have to wash the fabric in hot water first, and then dry it on high heat or on a sanitized in the dryer before you sew the mask, so that the fabric is cleaned before they get it. They had someone come through the hospital, she said, that was selling them for $5 a piece, but I don't want to sell them. I mean, I think they're on the front lines working and being exposed, and so I'm more than happy just to make them and pass them along to them so that they can use to protect themselves.
I think it is fantastic that you're stepping up and doing this, Peggy. Thanks so much for talking to us. We really appreciate it. Again, these are just the masks that she's making. We're seeing more and more people across the entire state and the country doing all this, trying to help with that mask shortage, just to keep our frontline workers safe out there.
Amazing that she's like, nah, I'm not going to sell them.
Yeah.
I just want to help. And they're going through masks like crazy, because in a lot of situations where floors are maybe super, hypoallergenic or something of that nature, they don't have the numbers to be able to just change masks every time they need to go in and out of a room. So. And
just imagine too, like, these are the frontline workers. What happens when they get sick?
Yeah.
They're the ones who take care of us, right? So we got to make sure that they're safe out there for sure. Now, if you want to help Peggy and others, we'll post a link showing the specifics of those masks that she's making on our Good Day Kentucky Facebook page, along with how you can get those masks to her.
So keep sharing those positive, uplifting stories of unsung heroes in our community. There are so many. Yeah. And then just tag us, ABC 36, in those pictures and videos so that we can share those with other folks here in Kentucky. Use the hashtags Team Kentucky and Together KY. Yeah,
and then tune in tomorrow. We're highlighting another unsung hero in these uncertain times, also helping our healthcare workers with a specific need.